So the background to this, you've heard quite a lot already about how challenging this disease is and that there's been little change of treatment and outcome for patients with osteosarcoma. However, it's even more than that. A lot of the studies that run, including the Euromos study, has really been for young people with this disease up to the age of 40, and for those, as Stefan said, with localized disease. But there are in fact many groups of patients that fall outside of this. There are older people that get this disease. There are those that have rarer primary sites, not only in the limbs, the arms and the legs, and there are those with metastatic disease, many of which who still do not have a standard of care. So we still don't necessarily know how to treat these patients. In addition, as we've heard, there are no new agents or no agents that are ready for phase 3 or upfront studies. In fact, in the UK at the moment, there is only one clinical trial that is specifically recruiting patients with osteosarcoma. And that is a very specific trial to which a very small number of patients are only eligible. We also know that there's more data coming out from sequencing and other studies, but this is challenging data. Osteosarcoma, as we'll hear later, is a very heterogeneous disease. There are no obvious targets that are going to lead us very quickly into a clinical trial. And this huge unmet need was recognized by many of us and discussed at length at the NCRI Sarcoma Clinical Studies Group. There was a strategy day held in 2016, and this really was prioritized that without any clinical trials in the horizon, what can we be doing to work together to improve outcome for these patients? And this led to the setting up of ICONIC, and the purpose of it really is to deliver a step change in the way we investigate better treatments and outcomes for patients, essentially doing two things, one of which is working together. So collaborating across a multidisciplinary field of clinicians and also scientists to work in a much more coordinated manner than we have in the past. And to do this by recruiting every patient in the UK that is diagnosed with osteosarcoma across all ages with longitudinal clinical data collection and tissue samples. So tumour biopsies at diagnosis and subsequently, as well as blood samples, to try and start addressing some of the biological and clinical questions that we have for these patients. When we set to develop a protocol and make an application to the Bone Cancer Research Trust, we thought it was important, first of all, to involve, as I said, co-investigators and collaborators across a whole field and disciplines in the UK. We felt at this stage that, in fact, we needed to involve a recognised clinical trials unit. As Stefan has very deftly illustrated, there's a lot of work that goes into collecting cancer data. We do have a national cancer registry, but it does not give us the level of detail that that is required to answer these questions. We felt it important to have patient input at the beginning of the study, and what we also wanted to do as much as possible is align the sample collection and analysis to ongoing funded projects to reduce costs, avoid duplication, and really increase in efficiency and outcome. We also aim to perform comparative analyses using the same groups of patients, which will give us much more robust data using smaller numbers of patients, particularly in this rare disease. So we've come up with a whole host of questions. First of all, we have some clinical questions. And simplest of which is trying to understand how people in the UK are treated for osteosarcoma, the variation in treatment both for systemic therapy, surgery and radiotherapy, and particularly for these ones with poor prognosis and the rarer sites of disease where less is understood and what happens to them. And use this information to develop more therapeutic protocols and improve management strategies, particularly for these patients at high risk. There are a number of biological objectives, first relating to tumour, being led by Adrian Flanagan, who will talk to us a little bit more about this. One is to determine the impact of intratumour heterogeneity and evolution of tumours. A lot of understanding has been gained in other cancers, but apply this to osteosarcoma to see what the effect of this is on outcome. And also try and, of course, identify some novel genetic and immune biomarkers through multi-platform sequencing. But ideally to correlate some of these findings to identify patients for therapeutic intervention or clinical trials going forward. We also have some circulating questions relating to identification of circulating tumour cells and circulating tumour DNA and how this may influence patients. You'll hear a little bit more about that later. Finally, what is important, and we heard some of what Frankie went through in his treatment, is about patient experience. And so we've tackled this in two ways. First of all, we're looking at some methods to validate a patient-reported outcome measure, and a specific one developed for sarcoma, looking to detect changes in self-reported outcome over time. We want to compare these with some standard quality of life assessments, and also look at patients' function, particularly after surgery, over time. And secondary, more recently, we've been able to add this to the protocol. It's something looking at routes and time intervals to diagnosis. We heard from Frankie how he was seen by 4 different doctors over a period of time who didn't recognize this. And the questions we want to ask is, we want to characterize that diagnostic pathway and see which patients are particularly at risk and how that may influence their outcome. We're doing this using some methodology developed by the International Cancer Benchmarking Partnership through questionnaires both to patients, clinicians, and to their general practitioners. But ultimately, we want this to be so much more than what we're starting out. We want to provide the infrastructure, Stefan used that word, to create a platform to conduct some clinical trials, therapeutic trials, and try and more rapidly investigate new agents. We want to be able to investigate more biomarkers that come along, use this as a platform, hypothesis generation, and increase collaboration. So we made an application to the Bone Cancer Research Fund, and very grateful that they have funded this project initially for 2 years. It constitutes 2 stages. The first is a feasibility endpoint. Can we actually do this? Can we collect good quality clinical data of all the patients, including surgical data and imaging data? We're going to determine the feasibility of establishing an imaging repository, as well as a data repository and a tumor repository. And can we collect these good high quality samples across all the centres in the UK? This aligns with the Bone Cancer Research Trust initiative, really to try and support that. We'll hear from Zoe a little bit later about that and some of the challenges, as you might imagine, with that. But also, can we recruit right across the UK? We heard Stefan say initially many paediatric oncologists involved, but how that's evolved over time. We want to see if we can recruit across the adult and paediatric centres, and across the surgical centres, as well as the oncology centres, and right across the UK, not only England, but Scotland, Wales, and Northern Ireland too. In this first stage, there are going to be some pilot and aligned studies, which we will hear about. Adrian Flanagan is leading some amazing work that is being done to understand the genomics of osteosarcoma. And Kenny and Robin and Dominic Heyman are looking at circulating tumour cells. They're also going to tell you a little bit about that, and also begin to see how able we are to collect all this data, the questionnaires, to answer some of the patient outcomes. I will say that the research infrastructure in the UK is very much supported by the NCRI and the use of research nurses that are supported locally, and this increasingly is a challenge. We've got a lot of data we want to collect, and we will need to see whether we have the resource to do this now and going forward. This is the longer term aim. We want to recruit up to about 200 patients in the first instance. It's nothing compared to the numbers that Stefan has told us, but at the later stage, we want to be able to analyze and validate and translate this into benefit for patients. Once patients have been on treatment for some while, we'll be able to look at their outcomes and relate it back to all this biomarker and other analysis that we're doing. But finally, of course, the ultimate aim is to improve interventions and get novel agents for the patients at highest risk. So I think, in summary, this is all about maximizing the benefit for patients, clinicians, and researchers, and developing this platform and learning from every patient that we treat to get together some clinical trials. We'll be able to add other companion studies. There's a lot of interest in imaging biomarkers that we would like to add. There's a lot of interest in local study therapies. Craig and Beatrice are going to talk to us about surgery and radiotherapy. But also we want data to apply for additional funding to support hypothesis-generated research, and we will have a repository and a biobank of biological samples, and really importantly with paired clinical data, so that we can interrogate lots of those questions and understand the impact of that on outcome. And finally, we hope that this will be an opportunity for increased collaboration both across the UK and more internationally. So the protocol has been finalised. It should be going to ethics in the next couple of days, and we will be having a launch meeting at the British Sarcoma Group conference at the end of next month. So I hope to be able to feedback some results in due course. But finally, I need to acknowledge many people that have been involved in this, the development of the protocol. As I said, it's very multidisciplinary and across all the different study groups, and also the UCL Cancer Trials Centre who are helping to run this. Thank you very much.